An Arizona health system is facing a critical staffing crisis, updating its guidance to allow COVID-19 positive employees to continue working. Dignity Health updated its policies, allowing workers who are mildly symptomatic or asymptomatic to continue offering care to patients at its hospitals and facilities while wearing N95 masks. The CDC's latest guidance does support this move in the event of severe staffing shortages. Omicron has been labeled by health officials as highly contagious, so the question is whether or not something like this could really be safe, even with the CDC's guidance. Here to help us break all of this down, Dr. Mercedes Carnethon, an infectious disease and I don't even know how to say that word. I mean, I do know how to say that word, but I don't say it very often. Can you say it for me?
Yes, I'm an epidemiologist.
Thank you. I was like, I would love for you to say that because I could say it if I had a little more kick in my tea here. Doctor, we've learned that this variant is easily transmissible. N95 masks offer the most protection. We've just seen some of that data come out over the past week. But a lot of people at home are thinking, okay, schools are stopped, locked down in some cases. Jobs, businesses have been drastically affected by this pandemic. There have been rules for mask mandates and vaccine mandates. Now, all of a sudden, it's okay if you're positive to go to work. I mean, can you see the confusion that some people think that this statement is to allow people to keep working even though they've tested positive?
It really is a challenge. And I think this is one of the big challenges that we're facing in the middle of this epidemic. This is why epidemiologist is now a household name. We are forced to do field-based public health. And obviously, one can't always do that under the best of circumstances. Certainly, we would have wanted to pull these people out of circulation so that they didn't have to work. But here's where the balance comes in between, what we're facing with the coronavirus pandemic and the ordinary illnesses that people show up with in the hospital. We noted last year excess risk of death from all causes, and that's in part because people aren't seeking help, and in this case right now with this highly infectious variant, there aren't providers available to help. So I see this as a choice that had to be made, certainly not the choice we would have liked to make, but one that we have to make under these conditions.
And the conditions obviously are staggering. I mean, hospitals need more employees to work as they're seeing more cases of Omicron, and then other things, other health battles that people face, whether we're in a pandemic or an epidemic or not. But these N95 masks keeping people safe, will these healthcare providers, will they only be around others who have COVID-19? I mean, how do you manage this?
That's a really good point. And I think those are some choices that can be made depending on what's happening in that particular hospital. The N95 mask should not only protect aerosols that are coming in, but should as well protect the patients who are being treated by these providers. So I wouldn't have significant concerns about transmission. Obviously, not having providers who are positive would make it a great deal safer, but we do now have the tools to try to keep this as safe as possible. And the infectiousness of the Omicron variant is very real. Ideally, if these healthcare providers are vaccinated and boosted, their course of illness should be relatively shorter. And so perhaps then it only turns into a few days where these asymptomatic providers are there and facing any degree of risk whatsoever. It is not ideal. However, people are still having heart attacks. They still need treatment for cancer and injuries, and we have to be able to provide that care.
I think a lot of people are very clear on the fact that Omicron has presented itself as less severe, even though we're seeing so many more cases and it's so much more transmissible. I think for a lot of folks, they're thinking it's not as big a deal because they're only going to have mild symptoms. Then you have other people who are saying you have workers in the hospital who have this highly transmissible virus among those who can't risk getting infected with a respiratory disease. So do you think other healthcare providers are going to be following suit here in light of the fact that we have such a grave staffing issue?
I do think that the reason the CDC wrote that guidance in to allow for this under times of pressure where there aren't enough personnel is because we do expect to see this more often. And I would really offer caution on the mildness of it. You know, it's mild if your baseline health is strong. However, if you have underlying conditions, you know, what turns into a mild illness, a stuffy nose, aches, may not be so mild for other people. So from that perspective, I think we need to take it certainly very seriously. Our hospitals are filling up both with patients who have COVID and those who don't.
I think that's why it's so confusing to allow people who are positive to go back to work, if that is truly the concern. Doctor, thank you so much for being with us and for breaking it all down. We appreciate it.
Well, thank you.
Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.